Welcome back, dear viewers, and our second guest of the evening is Dr. Sumant Mishra, pediatric dentist. Doctor, good evening and welcome back to Hala Kuwait.
Good evening to you and your team members, your management.
You're really welcome here, and we are having another amazing subject when it comes to children and their problems in dental health and how they take care of their dental health. Of course, we are going into diving, let's say, into the summer vacation, and kids and children, they get more sweets. So it's kind of risky sometimes to take care of their dental health. They need awareness from your behalf, doctor. So we're wondering if you can explain the unique aspects of pediatric dentistry and why specialized care for children's dental health is essential, because some people might be wondering, our viewers this evening, why we're focusing on children.
Kids are unique creations from the God Almighty. They form the future of any society.
Exactly.
The earlier, the better. There's a slogan saying, catch them young.
Exactly.
So, in the same way, catch them and treat them, educate them young. Because we have many benefits. If we treat them or train them or educate them early, it will be like early detection of dental issues.
Exactly.
Prevention of dental cavities, mouth diseases, or gingival inflammations.
Definitely.
Instilling them the habit of good dietary or tooth-friendly diet.
Exactly.
Also monitoring the growth of their jaws, their dentition, their arch, the teeth, all those things growth.
Definitely.
And then also removing the fear factor within their brain.
Exactly.
Fear of unknown is the worst fear for anyone. Forget about the kids.
Definitely. And doctor, about prevention is better than taking the road to treatment and getting anything that might conflict our dental health, especially as you mentioned for children. So we are wondering about the prevention strategies that can affect kids' dental health. Will you please tell us more about it?
Definitely, you're right. Prevention is better than cure. Al-Waqaya khairun min al-ilaj. So, the main mantra behind it will be brushing, brushing, brushing. Teaching them to brush. American Association of Pediatric Dentistry, AAPD, advocates brushing twice daily, 2 minutes per session, with soft toothbrush bristles, soft bristles of the toothbrushes, and toothpaste fluoridated, any toothpaste fluoridated toothpaste with the kids, but it should be fluoridated according to the kids' age as well.
Exactly.
And not only brushing the teeth, brushing the tongue is very essential, because after meals, a lot of bacteria, fungus, viruses, a lot of microorganisms go into the crevices, the deep fissures and the valleys of the tongue. So there are tongue cleaners, or sometimes the back of the toothbrushes as well. That has to be done as well. And while brushing, we have to memorize, we have to understand that the brush doesn't go in between the teeth. Bain darsin madish. So 40% of the plaque is still there in between bain darsin. So we have
It can be
floss, we have floss, we have interdental toothbrushes, so they go in between bain darsin to clean it properly between the teeth, and apart from flosses. And we have mouthwashes. More than 6 years of age babies can do mouthwashes if there is any bacterial inflammation of the gums. And apart from these preventive measures, we have fluoride. So fluoride naturally is found in milk, sometimes fluoridated water as well.
the natural content.
Exactly. And like makulat bahriya, seafood, apple, tufa, vegetables and fruits.
That's great.
And we professionally apply as well. The dentists apply to fluoride varnishes depending on the individual's caries risk. So these are some of the preventive measures. Of course, the parents' involvement is very essential. So parents have to lead by example at home. Lead by example, I'm talking about Brushathon, which is one of the campaign which I advocate. We
That's
have
great.
marathon, running together. We have speakathon, speaking together in a group. Why not Brushathon,
Oh,
brushing together in a
definitely,
group?
yes.
So
Yes.
invite your kids at home, to brush
Especially at
together.
young age.
Exactly.
Supposed to be at young age.
These good habits should be instilled at the beginning only.
Exactly.
So Brushathon and 2-minute challenge. We have nowadays many toothbrushes with timers, 2 minutes. Otherwise, if we give the control to the babies, kids, they brush within 30 seconds and then khalas, finish.
It's
But we have to
definitely-
make them aware about the importance of 2 minutes as well, as advocated by American AAPED.
Definitely,
American
definitely.
Pediatrics.
That's really helpful for them, especially at a young age. And doctor, you know, like one of the most well-known ingredients in toothpaste, fluoride. And you mentioned fluoride, and treatments like fluoride supposed to be and applied well to, and also to dental health, and dental sealants also important and works well. So when should children receive them? Because you know, when we go to the supermarket, doctor, we see like toothpaste written for children, and which make the parents more careful when they buy toothpaste for children and which toothpaste they supposed to use.
Yeah, actually, excellent observation by you. Many queries I get from the parents regarding this. So American Dental Association, American Association of Pediatric Dentistry, they always advocate brushing using fluoridated toothpastes. So you talked about fluoridated toothpaste, and also you spoke about Fisher's sealants. So sealants, let me start with the sealants. Sealants are tooth-colored resins which we apply, dentists apply on the back teeth, on the molars, premolars, because there are grooves, pits and fissures which are more susceptible to sticky food materials like chocolates and all those things, candies. They stick here and they act as the harbor for bacteria and all other germs. So we seal them using the Fisher sealants, so act as a protective layer. And fluorides, they get within the enamel, get incorporated and strengthen the enamel.
That's great.
In fact, they sometimes remineralize the dissolved early initial caries. So it's like strengthening the tooth enamel from within. So in synergy, when acting together, one of them, fluoride, acts to strengthen the tooth, and the second one, Fisher sealants, seals. So they are good pivotal role players in the prevention of dental caries.
Exactly. Let's mention something we rarely talk about when it comes to dentistry, especially when it comes to children and what they could have or face, or any risk that we can mention, especially when it comes to parents, because they are the first rescuers to any emergency for children. So what steps should parents follow or take if their child experiences a dental emergency, such as, for example, knocked out tooth or severe toothache? It can happen at night, it can happen in the morning, it can happen at school, but at the very end, parents are responsible.
Definitely. Kids and young adolescents are prone to tooth emergencies, like you mentioned about knockout tooth or toothache, because mouth forms the portal of entry, the gateway. All the food materials, whatever we eat or drink, goes through the mouth.
Exactly.
We eat hard, soft, hot, cold.
Everything.
All the insults coming on the teeth. One time it's bound to have some emergency or breakdown, failure.
Exactly.
So, in cases of knocked out teeth, when the tooth avulses, the parents or the nearby, the teachers, have to ensure that they take it out using the coronal portion, the crown portion of the tooth. They take out, they touch it, not the radicular, not the root, because root is very sensitive. There is some structures, soft tissues which should not be damaged. So take it out, gently rinse with the water, and try to place it back into the socket. If not possible, they should put it in a glass of milk.
Can be placed back.
Can be placed back gently if possible. If not, put in a glass of milk or within the saliva also in the mouth,
can
don't
be.
swallow. And the very essential aspect is to go to the dentist as soon as possible, because the first of all dry period is very essential.
Exactly.
Period outside the milk or the saline, and the insertion putting inside is also essential for the success of this tooth.
Exactly.
And the second thing about toothache, the parents have to see between the tooth, sometimes when they're saying within the tooth, between the teeth, there might be food particles. Floss them out, brush them out, gentle mai dafiamal, warm normal saline, warm water with salt, mouth, and then later on gives the proper dose of analgesics, painkillers, and approach the dentist the soonest possible, because the dentist will determine the etiology, the cause
Exactly.
for future stopping, preventing of all this toothache.
Exactly. Doctor, mashallah, you're in control, full control of children, and how to cure or fix or make their dental health better. So let's go more and know more about your secrets, especially when it comes to the clinic and when the children come to your clinic. You know, we hear stories that children might be panicked, crying, or they get scared too much, like, you know, they have a lot of ideas in their heads when it comes to dentists. So we're wondering about your techniques, especially like when children make their visits to your clinic, and how do you make it enjoyable, the visit, and also how can parents help to reduce their children's anxiety when they visit the dentist, or how do they prepare them for visiting the dentist?
This is very extensive question you asked me. We can write total book on this. But yeah, you're right. The philosophy of Oladat Mithal Oladi, your baby is like my own baby.
Yeah, you say that before they cry. Before, yeah.
When we, to calm down the parents at least, this sentence, the treatment starts right from the time we receive the kids from the reception. We look into the eyes in the same level, we call them by their name, Khalid, Shranik al-Yom, how are you, Khalid? By their name,
Yeah,
they get proper attention.
exactly.
And then the body language, the verbal, non-verbal communication skills, making the environment tooth-friendly, child-friendly, and then tell, show, do. Telling, showing, and doing them. Like we have to start with like something like, let's say we have, these
Toothbrush,
are toothbrushes, yeah, electric
Yeah.
toothbrushes.
Looks wonderful.
Yeah, we
turns
have,
on, yeah, needs a battery.
yeah, battery, electric toothbrushes, yeah, exactly. So
it looks charming, especially the colors, and it
Yeah.
can be appealing for them to brush their
definitely
teeth
for the
with.
girls we have
Yeah.
Pink and all those
Yeah.
Cinderella and all those Barbie and all those. The guys
Yeah.
we have Super and Batman, Spider-Man, Royal Hari, the Iron Man.
Yeah,
So start talking childrenese terms, the terms which children can easily recognize themselves. And by the philosophy of TLC, tender love and care, we can win over any child. We are basically, I'm dealing with under 6 years of age child, and we
Exactly.
don't have nitrous oxide sedation, or we don't have general anesthesia, so we have to do with local anesthesia only. So here comes the real role of a pediatric dentist.
exactly.
When the patients, the babies come inside crying or scared, and they go out laughing and promising to
Happy.
come back again,
That's great.
our tummy is full. Even million dinar cannot compensate for the happiness we get through the smile
Definitely,
they emit after
definitely.
this one.
And you share the responsibility temporary with the parents, especially when you are taking care of their dental health and guiding them to have a better dental health in the future and how to maintain it. Really great. Thank you so much, Doctor, this evening for being with us on Hala Kuwait, and wish you the best of luck with your future endeavors.
Thank you very much. Best of luck to all of all.
Thank
All
you.
of you.
Thank you. Take care.
Thanks.
The viewers, we just had with us Dr. Sumant Mishra, pediatric dentist. Let's go now check our third report of the evening. I'll be right back. Stay tuned.